Okay, thank you for being here today. So allow me to introduce myself. My name is Aricia de Kempenich. I am the Operations and Programming Director for the Network Towards Unity for Health, and I'm located in Belgium, and I'm here today with Nick. Go ahead.
And I'm Nicholas Torres. I'm the executive director, and I'm located just outside of Philadelphia in the United States. So we're going to provide you an overview of the Network Towards Unity for Health. So next slide. So we're an international, sectoral, intergenerational organizations. We're a non-state actor of the World Health Organizations, and we're focused on fostering equitable, community-oriented health services, education, and research with the goal of improving health locally and globally. Our focus is on convening healthcare organizations, primarily institutions and universities, community institutions, and thought leaders from all over the world. You can find us on our website. We have two websites. One is the main website where you can learn more about us, and you'll see a little bit later on, we have an online community where all of the members, institutional, but also individual, can find each other, work together, and collaborate. So how do we do it? So we're going to go over a little bit, just a history. We'll make that brief. Most importantly, we're presenting to you our strategy goals that we just completed for 2024, 2027, that is being built off the foundation that we laid from 2018 to 2023. And then we'll go over specifically, as relevant to you, what are our services and products and how can you get involved? We'll talk a little bit about our partnerships, and then we'll finish. You won't be part of it, but a discussion. So a little bit about the history. So we were created by the World Health Organization in two different initiatives. One was the network and one was Towards Unity for Health. And those were combined into one organization that we've existed around the globe. So we've had different secretariats. We were incorporated in the United States in 2017, and when FAMER became our secretariat member. Through that process, we have a rich history, but we have some focus areas, primarily social accountability and interprofessional education and collaborative care. So as we look towards the future, TUFH is playing three primary roles within the global health. The first one is a certification and evaluation, and under that is we are the driver for institutional certification and social accountability. It's really an institutional self-assessment. But as we move towards it, we want institutions to be responsive to people and society's needs, and we have the tool that does that, and we're working globally to do that. We're also looking at global learning. So when you look outside of your own institutional classes you provide for your students, there's other courses that may not be applied, but there's an opportunity for leadership, faculty, and students to participate in these. And so we're in the process of certifying our own courses, but also we are positioned to certify other people's courses. If you were interested in, say, we want a certification saying that our course that we want to provide to the globe is of quality. We're also, as workforce, is a huge component of that. We're looking at certifying non-traditional workforces. As we look at the workforce team, it's not just about doctors or nurses or dentists, but we have these community health workers and other workers who aren't necessarily recognized. So we're working alongside of WHO to see how do we recognize them and certify them. And then, in building our communities of practice across the globe, there should be content centers of excellence. We have some priority areas that I'll discuss a little bit later, but really looking at that, who's leading this and where can you go to find information about those. Our second role is really about global learning. And so our history has been by hosting a global conference. It rotates around the globe in the 7 regions. We will continue doing that. And that's the best. That's when everybody gets to come together and meet each other and really develop those relationships. But as mentioned above, we also host TUFH Academies. There's TUFH Academies both for leadership. There's TUFH Academies for faculty and 3 TUFH Academies for students. And then we have 4 TUFH Academies that are really priority health issues. And that's migrants, refugees, indigenous health, aging society in low and middle income countries. And what's the fourth one, Aricia? I just
Rural.
and remote and rural health. And then last on this global learning is because we have this online platform that you'll see a little bit later is it's really about relationships between organizations and people. So we have a platform, invest in this platform, where people can connect, not necessarily through us, but just through each other. So you can find each other around the globe. And then within those, we're developing those same topics that were in the TUFH academies: Indigenous, migrant, refugees, remote and rural, where people can interact and correspond across that. And then our third role is really building the local infrastructure, and that takes the focus on four areas. One is we're doing these national centers of excellence, which is really an extension of TUFH. So in one sense, we're licensing all of our services and products to institutions within a country, so that then they can become that center of excellence and attract other institutions to do the same amount of work. Within that is the idea, we host a global fellowship for social accountability, but we imagine that could be scaled or replicated within each country, so that we reach more people, especially schools within those. And then also would be replicated is the TUFH academies could be replicated through these national centers of excellence. And then last is regional conferences. And so the region, again, there's 7 regions as defined by WHO: North America, Latin America, Africa, Emerald, Europe, Western Pacific, and Southeast Asia. And so we've combined those into 4 regional conferences that gets a little bit more local towards what we're doing. And so here is, we like to think we're driving our work. Well, one is on the previous slide, you saw like we are focused and aligned with WHO's priorities, and then we translate those to our own driving priorities. But as you can see in goal 1 is like we have some very concrete things, aspirational. And so we're saying, we're thinking that 30% of institutions are really working towards social accountability defined by going through the tool. And then you have the same 15 or 20% are really have really completed that process, right? It's not necessarily part of that an accreditation process, but it is. But the standards are trying to be incorporated into accreditation, so it's really a tool to be responsive to people and society's needs. The second one is we understand in interprofessional education and collaborative practice is just how we work in a practical world. And so it starts at the educational institutions. So we have the TUFH Academy that really goes through that. And so we're saying if an institution really goes to the TUFH Academy, they're building towards an interprofessional team, and then that can be translated into the community where practice happens, in an interprofessional and collaborative care. And then the last one is again, going back to the workforce. We understand without the workforce, we can't move forward. And so we're looking towards how do we recognize those unrecognized health workforces and make them part of the health team.
So now that you understand all about the strategy, I'm going to talk more about what we actually do as the projects and the activities that you and your institution can be involved with. So the first one to discuss is the TUFH online community. So this is TUFH.org, which is the website that Nick was referring to earlier. So it's an online community platform in which all of our members can network and share. So in this, we will have the leadership levels, the deans, we will have the faculty members, we will have the health workforce, we'll also have our students, our young professionals from all across the globe, from different sectors. So they're really, really international and intersectional. The platform itself is very useful because you can find people in it. Like, for example, what you see on the image, you can go to the people, you can select people based on their region, you can find them per country, you can find them on areas of expertise, and you can also start networking. So you can send them private messages in the system, you can start group chats about people that you want to mingle with. So it's to keep networking through the year without being at a conference, for example. It is also the platform where we host our courses. It is a platform where you will register for events or conferences. So it's a very useful platform where everybody is welcomed. As an individual, you get a membership to it, be it a student member or an individual thought leader. As an institution or a strategic partner or a secretariat member, you will have the opportunity to upload a whole lot of individuals to it. Depending on your category, you have a certain amount of people that you upload. It could be faculty members, students, staff, depending on your organization. They each will have a separate account in which they can take full effect of the items that we do in the online community. We also have our annual conference. So our annual conferences have been going on since 79. So it will be our 45th anniversary this year at the Ubuntu conference. A little bit about the last years, you can see them here from 2017 in Tunisia all the way to last year in Sharjah in the United Arab Emirates. What's great about the TUFH conferences and a little different is that they are not medical conferences. They are, as again, we repeat, international, intersectoral. So we attract people from all across the globe and different sectors, not only in the healthcare niche, but also beyond. So we're also trying to achieve, getting health policymakers, economists. We also want to achieve with architects because they develop healthy cities and urban living. So there's really a quite big scope on working towards unity for health. What's also unique about our conferences is the conference on the move, where we actually take participants out into the community to explore things and see things themselves instead of just watching presentations. Our conference that is coming up now is the Ubuntu 2024, which will be in Cape Town, South Africa. It will be from the 10th to the 13th of September. The main theme is people, place, and policy for community wellness. The name of the conference is Ubuntu 24 because it is a joint conference between the network's annual conference as well as Rural Wonka's conference. So Rural Wonka has a conference every 2 years. Rural Wonka is the biggest group for GPs, family physicians in the rural areas. And so we are joining forces and we are being hosted by 5 partners: the University of the Western Cape, the University of Cape Town, Stellenbosch University, the Cape Peninsula University of Technology, and the Department of Health in Cape Town. So great opportunity to come and connect. It is a hybrid conference, so you can both attend in person and physical. We recommend physical attendance because you can really explore and network, but it's up to you what you want to do. We encourage submission for abstracts. The deadline is the 31st of March. Keep that date in mind. It is also the deadline for early bird registration. So if you plan to come in person, you should try and register before the 31st of March because you get it at a discounted rate. You also have the opportunity to go on a post-conference tour. You can check out the nice touristic activities around the area. If you plan to go that far, we also want to make sure that you have a great time where we are at. Next to our annual conference, we also have our regional conferences. So we've started that in 2022 because we wanted to allow a better focus on particular regional points that are of importance in that particular region, as well as to accommodate people from across the globe, because the annual conference will fit to the timing of that particular region and country, whereas the regional conferences can really fit to the dates and the times that are convenient to the people in the regions. They are usually organized by all of our international institutional, strategic, and secretariat members. So they're all joining forces. For example, you can see on the Americas some of the organizations that have already confirmed, and we are still growing our organizing committee. The theme of it and how it's run and what is at the event is really highly on the region. So each region comes up with their own suggestions for keynote speakers, workshops. Sometimes they like doing panels, others like doing oral presentations. The goal here is to really attract within the region. It is also only virtual, so there is no cost for traveling that is required. It's a great opportunity for students, young professionals, and others to just keep networking and present their work as well online. So these are per region. The dates of this will be, they will start for EMRO in the beginning of March, and then we will go out throughout the year. So your institutions can join the organizing committee of your particular region. Moving on from conferences, we have our academies. Nick was referring to our online courses, and these are the ones that we're referring to. So as he discussed, we have one dedicated for faculty. It's called the Health Work Education for the Public Good program. It consists of 4 TUFH academies. Our TUFH academies are the name for our courses, where they really focus on the health workforce education aspect of it. So they're looking at social accountability in health workforce education. They're looking at leadership within that. So it's really courses that are dedicated. It started now in January and it will end in August. It's about 8 months in which they have once a week for a certain number of weeks per course. They also get the great opportunity to work with people within their university on a project that makes importance and comes out with something that's of importance to their university. So the goal is to not just listen, but to do something with it. Learn what you're doing and implement it so that something can come out of it of use for your university. For the students, we have the International Student Training and Exchange Program called iStep. The goal there is really to allow students the opportunity to do a virtual exchange. So there is no travel. It is an online course for 6 months. So it starts in October and it ends in May. And every once a month, they meet on a particular team that they choose, and then they learn about the content as well as work with students from across the globe. So it's great for people to learn. Students can social determinants of health, and then they start comparing what a Sudanese student does doctor to a Colombian student to a Belgian student, and then it opens their mind to say, oh, well, it's very diverse. And it's also, again, intersectoral. We also have our institutional leadership, which is our social accountability fellowship. We've selected 14 fellows here that are social accountability fellowship at the moment. And then our student leadership, which is the SNOW Leadership Institute. So SNOW is the student network organization. I'll talk about them later. And this is the Leadership Institute really directed to their leaders so that we can help these students become the leaders of tomorrow, helping them to create their chapters in their universities, to really move forward with next steps, to provide them with opportunity to become involved in SNOW and beyond. And below the little summary, as I said, our courses, we refer to them as TUFH academies, and they're guided by the values that all teach, all learn, and we all learn best by doing. And they're taught through the combination of theory, lectures, and projects. Try to make it so that it's also something that they have to do within their community or based around their community, so that it's active as well. And they are complementary to any institution or strategic partner. So you don't need to pay extra for this. It's included in the membership, and it's a great way for institutions to provide, for example, their faculty the continuous learning that they need to provide every year to keep up. So it's a great way to sign up either your students or faculty or both to keep them on when it comes to the new topics of social accountability and so on. Then I'm moving on to the social accountability. So this is called ISAT, which is the Indicators in Social Accountability Self-Assessment Tool. It's a really long title. It's just meant that it's a tool that's been developed through PAHO, the NET, TUFH, and other thought leaders in the world. We're revising it again to make sure that it's up to date. And it allows universities to do a self-assessment about their social accountability. The goal is not per se the end, because what you see on the screen is the end result. When an institution goes through it, you get your self-assessment reviewed by an oversight committee, and then you know in which phase you are. The goal is not to be, all green, all phase 4, because in reality, almost no one is that perfect. But it's to understand in all these areas, where are we as an institution in our social accountability, and how can we improve? So if we know that, for example, on our student selection, we're in phase 1, clearly there's room for improvement. And then through TUFH and other sources, we can help you make sure that you improve upon that so that you become more and more socially accountable to the community and the people that you serve. The website will be also available here on the slides. It's socialaccountability.com, which takes you to the explanations that you need to know about the ISAT tool. We also have 2 journals. Education for Health is our peer-reviewed Medline Index journal, and that is the one for the network TUFH. It is really focused on the global models of health system integration and education that lead to improved health and healthcare delivery. It is mainly research-based articles, but they also have letters to the editor and other formats focused on health, education, that kind of thing. And then we also have collaboration with the Social Innovations Journal, which is more dedicated towards the innovators and entrepreneurs who work between private sector or government or non-for-profits and align them towards collective social impact and goals and public policy. So really on the ground, what works. And then we also have our student network organization that I've referred to before. So this is the student organization from the network TUFH. It is run by students for students. Their leadership comes from all across the globe and also different healthcare sectors. And they have their own international board, regional conferences, regional chapters. They also have chapters in each institute that they're trying to set up. So each institutional member has their own SNOW chapter to allow their students to be involved with SNOW and TUFH activities and to grow in their own leadership roles as well. So once we set an institutional membership, we will sure that you connect your students with SNOW so that your students learn about the student network organization like you're learning about TUFH. To end our discussion, I want to just showcase whom we are all around the table with. So our Secretariat Consortium, so the Secretariat is what hosts the network towards Unity for Health. We have multiple people from across the globe and organizations that we are fortunate enough to work with. So we have Woods System of Care from the US, the University of the Western Cape from South Africa, Nassau University from Canada, Universitas Gadjah Mada from Indonesia, University of Jazeera in Sudan, Sudan, the University of Limerick in Ireland, and FAMER, which is also hosted in the US. And as we've referred to before, we have a WHO non-state actor. These secretariat consortiums, they have representation on the board. They help us align the future, the strategy, the goals for TUFH as the secretariat members. We then have our strategic partners that we are lucky enough to have on board as strategic partners. Again, here from across the globe, we have the World Health, Women Health Together for the Future, which is an international organization on women's health, the Rural Coordination Center of British Columbia from Canada, University of Sharjah in Dubai. We have the JPAGO, which is an international organization based in African countries focused, the Social Mission Alliance based in the US, and then the University of North Texas, the Health Science Center at Fort Worth, which is our newest strategic partner. And then alongside those, we also have our institutional members, which are too many to list, but I can guarantee you that from all across the globe, we go from each region that we have representations, but here you can see who the other institutions are that you will be on board with if you join TUFH. These institutions all have their individual members also in the platform, so there's ways to connect with these institutions. And we've seen in the past that beautiful networking relationships can happen that way, and also collaborations on projects on this. This is again why the online community is useful, or if you attend the conference, this is also probably where you get to meet people from these universities. To end a little bit more about the membership, if you've joined, you already know, but now you know more about the benefits, which are all here. And then for those that still want to join, the membership fees are here. We always differentiate in everything that TUFH does, depending on the country status. We have high income, middle income, and low income, which we do according to the World Bank. And then we have different categories. So students can join at a very low fee. They can join for 3 years, and all the other categories are for 1 year. First fivers are the first young professionals in the first 5 years after graduating, individual thought leaders for the individuals, and then we have our institutions and our strategic partners. If you wish to contact us for any question that you might have, you can reach us at the Secretariat at the Network TUFH, and our website is there. From that website, you can find the websites to our annual conference, to the ISAT tool, to the SNOW website, so everything's available there. Thank you very much. I hope this has been informative. I hope to hear from you soon.